Welcome to the Rhode Island Community DD Forum. Tuesday, September 17th, 2024. Hosted by Advocates in Action, Rhode Island.
Kelly, do you want to kick us off?
Welcome to the the quarterly Division of Developmental Disabilities Forum on Zoom. Here is our Assistant Director of DDD, Heather Mincy.
Oh, thank you, Kelly. That was a really wonderful introduction. I wish I got that introduction.
I know, live up to that.
I know. It's like drum roll, please. Thank you so much for everybody for attending this, especially I know it's such a beautiful day outside. So we really, really do appreciate you joining. We have some really good information to get us started during this community forum. We're going to have the statewide workforce initiative discuss the work that they've been doing. As people may know, some of you may not, that one of the main areas of work under the consent decree is around workforce stabilization. And so without a stable workforce, all the other tasks that we need to complete would be very hard to do because we need the support services in place in order to be able to do that. And we need to be able to maintain or sustain a workforce. And so I'm going to hand it over to Kim Einloff to talk about the great work that she's been doing. And there's a few different teams that are going to discuss the work that they've been doing too. So handed it over to Kim Einloff, who works at the Sherlock Center now, just in case everybody doesn't know. I think I gave that information out previously in some meeting, I think before Kim had actually told people that. But now at this point in time, I think everybody knows she is at the Sherlock Center. So we're very happy to have Kim back amongst our community, although I don't think she ever officially left. She never did, but she's officially back in full capacity working with us. So thanks, Kim.
Oh, thank you, Heather. I appreciate that warm welcome. And what a nice introduction. We're just going to keep passing that along through this meeting, right? That's good. I like it. All right, I'm going to share my screen, or at least that's what I plan to do. Let's see what happens.
All right, can everybody see the screen now?
All right, I'm seeing enough thumbs up that tells me I should go ahead and continue. Can you hear me okay also? Thank you. Thank you, Michael. Excellent. Well, thanks for having us. As Heather mentioned, we're doing some really important work regarding our direct support workforce over at the Sherlock Center, and we love our partnership with the Division of Developmental Disabilities and the consultants that are helping us move forward over at Direct Support Workforce Solutions. It's a team of people at the University of Minnesota's Institute on Community Integration. So we are going to provide some highlights from our work. It's not going to be everything we're doing, but it's probably the more exciting things and the things that we think will be really helpful for this community. Today, we'll be covering some updates from some of the work groups, which include the Data and Reporting Work Group, the Training and Professional Development Work Group, and the Policy Guidance and Worker Voice Work Group. And then we're going to have a quick word from the consultants that I just mentioned earlier. They're going to tell us about an opportunity for provider organizations. And then I'll do a very, very quick wrap up. So without further ado, I am going to turn it over to Julie Bershadsky, and she's going to give us an update on the Data and Reporting Work Group.
Thank you, Kim. Hello, everyone. So the Data and Reporting Work Group, as you may or may not know, the two sort of big tasks that work group is working on is really building or working on building a infrastructure to support workforce data collection and then use that data to make decisions, right? So how do we, now that we've collected the data, how do we use it to really understand what's happening with the workforce in Rhode Island and make decisions on that? Next slide, please. So as an update in terms of what the group has accomplished, my team at University of Minnesota has finished collecting the last round of workforce data from 34 provider organizations on Rhode Island. 33 of them successfully submitted data for the previous 6 months, that is January through June of this year. And the data and reporting work group will be reviewing the results from that last round of data collection at its next meeting, which is going to be in October. My team is creating a draft report based on the results of those data, and we'll be asking the data and reporting work group to review that report, give feedback, and then help with sort of dissemination and explaining to people what it means and how they can use it. We're also working on a draft data collection approach for the self-direction workforce, and we will be asking the data and reporting work group to review that draft data collection approach at their next meeting as well. So lots of things to come. Next slide. As a sneak peek, just a couple of things to show you today. This is from that last round of data collection that I just mentioned. This is just a couple of data points that are meant to illustrate some of the trends that we're seeing. So, as I said, the time frame for this data that you'll take a look at is January to June of this year. Data collection itself took place in July, and we had 33 out of 34 provider organizations that responded. Next slide. This slide shows hourly wages. So in sort of the darker brown, whatever color that is the starting hourly wage, and then the slightly lighter brown color, that is the average hourly wage. And then what you see is the 4 periods of time. So on the very left is where Rhode Island was 2 years ago in terms of starting hourly wages and just average hourly wages. And then on the very right is where Rhode Island is in this last round of data collection in terms of starting and average hourly wages. So as you can see, the wages have gone up, which is a good thing. And also what you see is that the issue of wage compression, which is the sort of that difference between the starting wages and average wages, is slightly less than it was in the beginning. So there's less of that, but it's a definite improvement, probably still room for more improvement on that front. So sneak peek on the wages. And then next is going to be, next slide, please. Turnover and vacancy. So in blue is the turnover ratio, which is it's how many DSPs have left their position in 6 months out of all of DSPs in the organization. And then in green is the vacancy rate, and that is how many open unfilled positions as percentage of all positions there are in the organization. So again, what you'll see on the very left is your Rhode Island's data on turnover and vacancy 2 years ago. And then on the very right is Rhode Island's data on turnover and vacancy from this last round of data collection. Again, good news, both the turnover ratio and the vacancy rate are going down. So the turnover has gone from about 21% to 15% in this last round, and vacancy from 17 to about 12. So it's a definitely good trend to observe. It's a definite trend. It's a definite trend in the statistical terms. So, and next slide. Okay, one more quick data point, and that is this is a percentage of organizations. So out of those 33 that reported those numbers, how many of them said that they had to turn away referrals because of staffing shortages in that 6 months? So 2 years ago, 63% of those of the organizations said that they had to turn away some referrals. As of 6 months ago, or as of this last 6-month period, that percentage of organizations is down to 33%. So going from 2/3 of the organizations to 1/3 of organizations that had to turn away referrals due to the staffing shortages. So good news, good trends, keep it going. As somebody who lives with data, this is something that I definitely take note of and would just like to say good job. Well done, keep it going. So, all right, I think that's it, Kim, right?
Yes, thank you, Julie. Before we move on to Rob, I just wanted to see if there were any questions, or is there anything in the chat for Julie? Any questions about what she just shared?
This isn't a question for any. This is just to let you guys know, because we didn't say this at the beginning, that we record these, and so you'll be able to watch them later. And any links or information that gets shared, you'll be able to see it again.
Thanks, Deb. Okay, so we'll move on to, thank you very much, Julie. I find the data really interesting, and it's good to hear that it's trending positive. So
I agree.
Thank you for that. Yeah, thanks, Kathy. Okay, so I'm going to turn it over to Rob, who's going to give us an update from the Training and Professional Development Work Group.
Thank you very much, and good afternoon, everybody. I have the privilege of leading, along with Elton Barbosa, the Training and Professional Development Work Group. It is comprised of DSP practitioners themselves, supervisors, participants, clients, and others, and agency reps as well. And our focus is really on the kind of pre and post training ecosystem, what helps professional develop folks, and the kind of regime of professional development that exists. And so our goals in that regard are to develop clearly defined training and supports for DSPs that result in high quality services for everybody in the system. Develop clearly defined training and supports for frontline supervisors that result in stable and competent DSPs. We want to look to build career pathways for DSPs and frontline supervisors, and develop opportunities for workforce staff to practice their skills and network with coworkers. So really on that kind of professional growth and training, and what assets are currently in place and what are missing to help empower that. Next slide, please. So this work group builds on the previous competencies and a prior sort of training work group, kind of a 1.0, so to speak, that issued direct support professional competencies. They were out to public comment. They were revised. I don't want to say this was in late 2022, early 2023. And so from that, thanks to this group and their commitment, we met some other important milestones. We had prepared a direct support professional onboarding and training framework, and that was at kind of this at higher and at the 30, 60, 90 mark. What should a typical prototype sort of experience for a DSP look like? It is not one size fits all. It is not mandatory. It is a reference document that can be customized to everyone's unique situation. But generally, what sort of training, professional development, mentorship, meetings, and resources would a traditional DSP need in that first quarter or so of employment? So the work group spent many months on this document, and then it was out for, I want to say, a 2-month public comment period. That public comment period closed about a month ago, maybe more. That comment was all reviewed, even if it was not necessarily germane to the document. We made sure it got into the hands of folks that could act upon it, and the template was edited where appropriate. That final draft was shared with the work group, who endorsed it. The draft actually completed final proofing. My apologies for the out-of-date slide here. That's my fault, but it was proofed, it was updated, it was polished and ready to rock. And happy to say that it has been issued, shared with a number of parties, and we can happily share it even more broadly. It's an interactive or editable PDF document. So that was a kind of a useful tool, another tool in the toolbox. We are currently working on a kind of associate document to that direct support professionals competencies document I mentioned earlier, a frontline supervisor competencies document. There's a good rhythm and rhyme between the two of those documents, but of course, for very different purposes and audiences. That document has been reviewed. The draft is being prepared, and I want to say that probably by the end of this week, will the work group have given its official sign off to the draft, at which point we'll make it available for public comment as well, for at least a month, perhaps two. And of course, we'll make sure that anyone on this call that's so interested will have the opportunity to review those comments, those documents as well. With those two either over the finish line or pending, we are now putting our heads together on identifying the current ecosystem of pre- and post-employment training resources, as well as the concept of credential or certification for the DSP position at our next meetings. So a lot of work underway and a lot of work accomplished. And so, any members of this work group that are on the call, thank you for all your hard work.
Thank you, Rob. Appreciate your dedication to this group and seeing the many different documents that you referenced through. As I mentioned in the chat, I'll be putting several documents in the chat where people can grab them and download them and read them later. The training and professional development group has been really cognizant of serving all employers in thinking about how they're training and providing professional development opportunities for their DSPs. So whether that's provider organizations or people who self-direct or families who direct services for their loved ones, we intend to produce all of our documents in English and Spanish and are intended for the broad audience, the direct support workforce and the people who employ them. So like I said, I'll be dropping some documents in the chat. The third person we're going to hear from, actually, I should pause and see if there's anything in the chat. Are there any questions for Rob or anything that he reviewed? Okay. So we'll just move forward then with Kelsey Collins, who's going to provide an update on the Policy Guidance and Worker Voice Work Group.
Good afternoon, everyone. As Kim mentioned, I am one of the co-leads of the Policy Guidance and Worker Voice, along with Jenna from CPNRI and Esther from LAZO. As you can see here, our work group has two main goal focus areas. The first is increasing the DSP voice in workforce development and other related statewide workforce initiatives, activity, and policy. And then goal 2 is creating a well-planned policy advocacy plan that engages and provides talking points for all stakeholders about the DSP workforce challenges and solutions. Next slide, please. So 2 of the things that I'm really excited to talk about today, one focuses on goal 1 and one on goal 2. So at the top here, goal 1, increasing the DSP voice in workforce development, something that we noticed in our work group and shared the same common theme with other statewide workforce initiative work groups is the need for more representation from the workforce itself. We have a great representation from providers across the state, but we really were focused on, especially in our work group, being policy guidance and worker voice, hearing directly from the worker voice. So we developed an informational kind of recruitment flyer that we've used to help recruit members, not only for our work group, but the other work groups alike. We have one new member that has joined us since we've created that. So we're looking forward to hopefully getting more members as the work continues. The second topic I'd like to talk about today is something that I'm really excited about, and those are DSP listening sessions that we'll be hosting just next week, so really soon. This is something that our work group has been working towards since I've been involved with it. We talked about it a lot at the summit in January, and we're finally at that finish line. So we'll be hosting 10 listening sessions throughout the state. We have at least one in each county so that we can make sure we are able to host a diverse group of DSPs. The goal is to hear their experiences and learn how their jobs can be improved to not only inform future workforce activities in the statewide workforce initiative, but other advocacy priorities that they might want to focus on as well. We're super excited to say that we have 66 DSPs already registered. Registration is closing on Friday, so we're hoping that we can get even more by the end of the week. As Kim mentioned, she's going to be dropping a bunch of stuff in the chat that will include that recruitment flyer that I talked about in both English and Spanish. And then we have a flyer for the DSP listening sessions. We have one in English and one in Spanish for that as well. So we're super excited about those, and we can't wait to report out at the next forum on the results of those. So looking forward to it.
Thank you, Kelsey. Does anybody have any questions for Kelsey before I move on to Megan? Anything in the chat?
I have a couple questions.
Sure.
What does DSP stand for? I don't even know if I'm in the right forum, but it's interesting information, so I'm going to stay and maybe someone can talk to me later. But can you tell me what DSP is? I don't know what that is.
Yeah, so DSP stands for Direct Support Professional.
Okay, thank you.
Great question. We use our acronyms a little too often.
This is the Developmental Disability Community Forum. It's quarterly. So it's if that helps. I don't know if that's what you were looking for, but that's what this one is.
Well, I don't want to interrupt your flow here. So I'll ask my question at the end and I'll tell you why I joined. But
thank you. Well, I'm glad you're here, and I'll drop my contact information in the chat, and you're welcome to reach out to me if I can be helpful. I'm going to turn it over to Megan, my colleague from the University of Minnesota's Institute on Community Integration. She's going to talk about a new and exciting opportunity for provider organizations.
Yes. Hello, everybody. We have a new opportunity, as Kim said, for folks who, for providers. So if you are a provider organization who saw all of that data that Julie shared at the beginning and have your data and aren't sure what to do with it, or if you have high turnover or are struggling to train your employees or are struggling to retain your employees, we can help you with that. We're working with the Sherlock Center, so the people like Kim, to work with you all to go through a discovery process where we take a look at your numbers. We do focus groups with your DSPs, your direct professionals, and your frontline supervisors. And we kind of look at your policies and your procedures in different areas. And we end all of that work with a report that has recommendations as to how you can better hire, train, and retain employees. And then we help you implement some of those recommendations. So we're recruiting for a new cohort. We've worked with 11 organizations so far in the state. And if you are from a provider organization and would like to get involved, you can email us at riswi@umn.edu, and we can connect with you more. At this time, I'll also say for folks who employ direct support professionals who in self-direction. So if you are in self-direction and you're like, well, where's the stuff for me? That is coming. So that will come, and we will let you know when that is available, and when that when that resource is available.
Thank you, Megan. Does anybody have any questions for Megan before I wrap us up here?
There is one question. Andrew, did you want to read that in the chat?
Sorry.
That's right.
The question from Ann Peters was just wondering how to invite the DSP. Just went out. He went out. If worker not aware, where is that info?
For the DSP listening sessions, the direct support professional listening sessions, is that what the question is about, Andrew? Okay,
Yeah,
sure.
Yes.
Sorry, go ahead. Hi, Anne.
Hi, I was just wondering if there's a listing of the invite in case I'm aware of any staffers who hadn't gotten it.
Great. Yes, I'm going to share the flyer in the chat shortly.
Thanks.
No worries. Great question. Thank you. So I think my last slide is this one in regard to the summit. We have annual summits, and the next one is scheduled for January 29th, 2025. The time is to be announced, and it will be at Alger Hall at Rhode Island College again, and that's based on the feedback that we've had from the participants from previous summits. We love coming together. We love creating opportunity to provide updates in regard to the statewide workforce initiative. We, of course, love to celebrate our work. And from feedback, we understand that people really enjoy the opportunity to network and collaborate. So this is sort of a sneak peek. A save the date has not gone out yet. So if this is news to you, you didn't miss anything. This is the first time that we're presenting this date. You will get information as we get closer to January 29th in 2025. And really excited to see where we're at that point, and welcome you to join us in discussion.
I have not attended any of the meetings because I was not sure. Really, I didn't have really much understanding about the meetings.
Okay, Jeff. Well,
yes,
I'm happy to catch up with you.
I've gotten the emails. I've gotten the emails.
Okay.
I do self-direct, and so they can bring me to the meetings and all that.
The audience,
excellent,
Kim. So the audience is people who get services also are also invited, right?
Yes.
Yeah.
Yes.
So you should go, Jeff.
All right.
Yeah.
You should talk to us about going from.
I will include my email address in the chat. I would encourage anybody who's interested in learning more about the statewide workforce initiative to reach out to me. As we mentioned throughout the presentation, we have a bunch of different files to share with you, and I'll get busy with that when I'm not talking. Deb, do you have something?
Just can you share Areta's question too in your answer so that people know that about it being available in Spanish also? She had asked about. You want to ask it again, Areta?
So my question is one of the 9 or however many listening sessions you have, is one going to be in Spanish? Not that you're providing an interpreter, but is it going to be conducted in Spanish for DSPs who don't speak English?
Right. Kelsey and Esther worked together on deciding whether or not we would offer it in Spanish or provide language access. And it was decided amongst the co-leaders to provide all 10 sessions in English, but of course offer language access at any one that somebody makes that request.
I have to ask an obnoxious question because it's my forte, okay? Are the people who decided, do any of them speak Spanish or do they all speak English?
Esther speaks Spanish.
Yes, one of the
and Esther works here, so I would have thought she would have said we should have had one listening session in Spanish because it's different. It's not the same when you're interpreting versus having the whole presentation done in Spanish, the listening session in Spanish.
So is it written in stone, Kim, or can you do it? I mean,
well, they're on Monday and Tuesday, and so we didn't make those arrangements, but I absolutely welcome I welcome the feedback and certainly am happy to offer it. So as well as online sessions, that's something else that we've talked about providing in the future. So we want to meet people where they're at. So happy to provide other ways to deliver these listening sessions if that's what people need.
That's what they need. Thank you. That's great.
Yeah, of course.
Thank you.
My pleasure. My pleasure. Any other questions before I turn it back over to Heather? All right. Thank you very much.
Anna,
Oh,
Anna,
go ahead.
oh, sorry. Anna had a question.
Sure.
She had put in the chat, what's the process of DSPs? Anna, do you want to expound on that? Do you want to tell us more of what?
Yes.
Okay.
That was the first thought that came to my mind of looking at the PowerPoint. It's like I know, like kinda, like I know where I am and kind of what I'm doing. In my current role is great is confusion, but I definitely always wonder like what I know the circumstances about DSBs, but I wanted to know more about it and what's the process actually of it.
Okay. Of becoming a DSP or specific to the DSP listening sessions?
I think of becoming one.
Okay. Fantastic. I would love to connect with you. I'm going to put my email address in the chat and I would invite you to reach out, and I would love to talk with you more about that process and how it is that we're working toward attracting people to this profession and training people to be great DSPs and hopefully retaining people so that they're happy with their careers. So I'd be happy to connect with you, Anna, after this meeting. Fabulous.
Thank you.
You're welcome. Any other questions before I hand it back over to Heather? All right. Well, thank you all for giving us your time and attention. I really appreciate this opportunity, and I'll get busy in the chat.
Yep. Thanks, Kim, and everybody else who presented. That was great information. It really was. So thank you. All right. So I am going to provide a brief update about the consent decree, just to let everybody know that we are making substantial progress towards our consent decree mandates. There's several areas we are in compliance, but as everybody knows, there's still work to do. There's always more work that needs to be done. The court monitor has stated that within the next 2 years, his focus is really going to be on the quality and efficiency of our support services and the work that we're doing to comply with the consent decree and the addendum. And I believe what he is most concerned about is really making sure that people who are in the adult service system and their families really understand what services and supports are available to individuals, and really getting all of that information out to everybody in our system in a manner that is accessible to them and that they understand, so that they can make informed decisions about how they're supported. So they have access to employment supports and also access to supports that help them become more and more engaged within their community. One of the highlights that I want to mention for the fiscal year 24, which would have been July 1st of 2023 through June 30th of 2024. One of the targets that we needed to meet through the addendum of the consent decree was to get 125 individuals employed to assist people in finding employment and securing a job. And I just want to say that we were able to meet and actually exceed that target. So 175 individuals actually were employed during that time period. And I just want to say a really big thank you to our supported employment providers, DSPs, family members, you know, and our internal employment team, because without the help of everyone, we wouldn't have been able to meet those targets. And so we are very, very grateful for that. And also want to add to that, that we still have more work to do, as I said just a minute ago. For the fiscal year 25, which started July 1st and runs through June 30th of 2025, we need to now work towards getting additional people help in securing jobs. We have 175 individuals this fiscal year that we need to work on. Again, helping getting jobs. And so we'll be working with all of our partners to make that happen. And hopefully we'll be just as successful as we were this past year. I'm sure we will. And there was actually somebody who put in one of the questions that they wanted to find information on how to find a job or how to get help with the job. So I just wanted to say, if that person is out there today in the audience, please, if you're comfortable, put your name in the chat, send us some information, because we really would like to connect you with our internal employment team so that we can get you the supports in place or connect you to any job openings that we know of, because, you know, that is one of the things we're here for. So I was happy to see that question there. I'm going to turn it over to Jay for a minute, who's just going to give some information or updates on employment. Jay?
Thank you, Heather. Sorry, I was traveling on the road. I just got in the house. So I just wanted to update everybody on the add-on budget. It's been almost a year now. So as of October 1st, 2023, if you're looking for new or improve on your supported employment funding, you go through the add-on budget. It's a separate fund now. That is not part of your regular authorization. So it helps to keep it so you don't have to take away from your community support funds, and you can focus on employment services, whether that's job development, job coaching, retention. We have personal supports in the workplace. You can find more information on our website. The purchase orders do not have to be submitted with your annual ISP plan, which is good. So you can submit them at any time that you need services. So you just want to make sure that you do have an employment goal in your ISP or your person-centered plan. The other thing I wanted to remind everyone about is making sure, if you are already employed, to get your employment earnings and reporting forms in, which we call the ERF, and would appreciate getting them in. It's a way that we can keep track of who's working, and it's also a way that you can make sure that your income is getting disregarded with those forms getting submitted. So other than that, I don't have anything more. But as always, Elvis and I are available for questions or for you to reach out to us. I'll put my contact information in the chat, and look forward to hearing from anyone that's out there that is looking for some help.
Thank you, Jay. All right, now I'm going to turn it over to Brenda, who will talk about the DD reorg and conflict-free case management. Brenda?
Good afternoon, everyone. So I am excited to talk about conflict-free case management, where we are with things as of today. I was reflecting before this meeting and sort of remember that it's been 6 years that since I've been working at BHDDH and working towards getting conflict-free case management off the ground and started. And we are finally ready to say that we are at that place. So in response to conflict-free case management getting started very soon, we are restructuring our internal casework teams. So we have gone through a process to sort of realign ourselves to the work that we believe will need to continue to happen. And we want to make sure that we're doing sort of the best job to provide the services and supports that you need from our division. So once you get connected to a case manager, the work of the department will be sort of things that go around that. And so what we are doing is youth in transition is an area that we have always wanted to do much more with. We think that helping people up front when they're first entering our system is super important. It's important for people to understand what this system can offer to them and how to go about utilizing this service to the maximum extent possible. And so we are putting 12 new social caseworkers in that unit to work with those youth in transition as they go sort of from the high school sort of world into adult services. We are adding some social caseworkers into our SIS unit, so the unit that does assessment. We want to make sure that we are able to do them timely and make sure that people are having the opportunity to get those done in a timely way, especially when there are things that happen along the way and they need sort of a reassessment. So we want to be responsive to that, and we need more staff in that unit to really do that. So we're going to do that. We also have a unit that will be dedicated to plan approvals to make sure that that happens in a timely way. We have added a few people to our residential team, so to make sure that those matches and finding residential placements and addressing those needs happen in a timely way. And we have a few more folks added to help with that. And so that's how we're restructuring. Nothing is happening today. It's sort of going to be a gradual process. So as folks shift to case management, our social casework team will be relieved of some of those duties and will be able to take on sort of their new duties. What we've sort of shared and explained with our caseworkers is, what they do now is they work with quite a large number of individuals. Most of our caseworkers currently have about 200 people on their caseload. So they're working pretty actively with 200 participants at any given time. That's a lot of people. We want to be able to be more responsive, and through case management, or we're also, you may have heard the term independent facilitation, same thing. We know that we need to realign the work to make sure that everything is happening the way that it's supposed to. So starting in September, everybody is going to be receiving a letter in the mail. It's a notification that talks about sort of where we are with things. Those letters are getting sent out sort of any day now. They're in both English and Spanish. It's like one flyer. It's got English on one side, Spanish on the other. It'll also be posted on our website. And you can look through that letter and just explain a little bit about what's going on. In September, the first referrals to case managers will happen. We're going to do it very gradually and in very small numbers. So our very first group of referrals, there'll be 123 people. So we're going to go small. We have 4 certified conflict-free case management agencies. They are Child and Family, West Bay Community Action, CareLink, and East Bay Community Action. We also have a group of folks who will work specifically with the self-directed population. We're calling them independent facilitators, basically doing the same thing that a case manager would do. And we also have a team of social caseworkers that we've hired specifically to do just this work. So we are hiring 18 people internally to do this work, 2 supervisors and 16 caseworkers. We've hired 9 caseworkers so far and 2 supervisors. So we are ready to get started. And once training is completed, we are hoping that they will be taking on case management activities as well. So you'll be hearing lots more about case management. We will make sure that we are updating our website with the latest information. And we are also trying to make sure that in the newsletter, we are providing the updates so that everybody can stay abreast of what's going on. I will put my email in the chat, and I welcome questions, things you want to know. Really, there's nothing that you need to know or do specifically right now. Just know that it's happening and look for that letter in the mail. And when it is your turn, then a case manager will reach out to you and contact you along with a caseworker that you may already know, to make sure that transition happens smoothly and everybody's comfortable.
Hi there. Can I ask a question? All these new numbers, the 12 people here and the 12 people there, are these additional people being hired in this for DDD, or are these internal shifts and current responsibilities? And if so, are you looking at the state workers being the primary source of this independent facilitation, or those will be the agencies?
So what we're doing, so the numbers, so we are hiring some brand new people. So we're adding staff to our team. We're adding 18 individuals to our internal team. Those 18 people will be responsible for independent facilitation or conflict-free case management. We are also working with brand new organizations, the ones I mentioned, Child and Family, CareLink, in order to also add to the system and serve as conflict-free case managers. And then the other option is for folks who self-direct, plan writers. There's many of the plan writers have become independent facilitators or conflict-free case managers who will also do the work. So we have, we're trying to grow our capacity to make sure that we can serve the entire population. Does that answer your question, or did I miss a piece?
No, it starts to answer the question. I guess it does. I always say the devil's in the details.
Sure. I agree with you there.
Any other questions? I can't see if people's hands are up, Deb or Michelle, so if you see. No.
Zulima Gomez. Where are you, Zulima? I'm sorry if I'm not saying your name right, but it says you raised your hand.
I just clicked the button to allow you to talk. Yep, go ahead.
Thank you, Michelle. Sorry, I think I'm still not a panelist. Anyways, you probably can't see me, but my name is Zulema Gomez. I'm from the city of Central Falls. I just started joining the monthly or the quarterly calls. No, I just wanted to say I'm from the city of Central Falls. I learned about you guys through Elvis, who came one time to the city of Central Falls, letting us know about the important work that I usually call you guys Buddha here in Central Falls. You know, Mayor Rivera is also very, very a huge advocate for folks with disabilities. She's hired a student from Central Falls High School who really, really enjoys working here in the city. But one thing that we have struggled with, and I don't know if it's something that eventually you guys can talk about in the future, is for employers like, you know, a municipality, where are like certain funding sources, you know, because Central Falls unfortunately doesn't have sometimes the monetary resources to hire you know, extra individuals. How do we also tap into grants? So if there's any, like, if your team knows of like certain organizations nationwide that we can tap into and look into, so that our fund developer can apply for these grants, because we're always looking at different ways to, you know, hire more individuals in the city of Central Falls. So yeah, that was it. I just wanted to kind of just say hello and thank you guys, and also how do we get those resources here in the city?
So I'll jump in to answer this question, and also I don't know if Rob is still on the call from DLT too, if he might have any input, but there may be, you know, funding, outside streams of funding to assist agencies to be able to assist employees that you may have that need certain type of accessibility measures to assist them with completing their jobs. Often there's different types of training programs too, where people can get funding for, but there's not really any funding out there to assist with wages necessarily that people would be getting paid, unless people are doing certain types of job trials. But if you're interested in more information about that, I can get, you know, we can have a meeting with Elvis I can make sure that he reaches back out to you and we can, you know, have more of the discussions to see exactly what it is that you're thinking, you know, how you would like to partner with us, because we're always looking for partnerships, and Elvis is really doing great work out there. So I'm glad to see that you are here and
Be a
part of
pleasure.
it. And definitely we can talk more about, you know, some of the things that I think you're asking about.
I
Yeah,
am
no.
here, by the way. My apologies, though. I stepped out to the restroom. If you could repeat
No
the question.
breaks, Rob,
I'd
no
probably-
breaks.
Sorry. I'm very sorry about missing the question, but I'm happy to answer it if you could repeat it.
Yeah, I think, so I think she was looking for, and can you tell me again how to pronounce your name? I'm sorry. Is it Zuima? You're on mute too.
Zulema, yep.
Zuema, okay. So Zuema was asking, she had met with Elvis, or somebody in her office had met with Elvis, and they were just thinking about how they can engage with the state in employing individuals with developmental disabilities, and what types of like grants might be out there to assist them with doing some things. But I think it's a bigger discussion that potentially we could have at another time, but I just knew you were on here too. So, but we can have, like I said, we can
I
have
can keep it to 20 seconds. We do have some programs here at DLT, some state funded, which are often more flexible, but not as lucrative. Some federally funded, which are usually more lucrative, but come with a mountain of paperwork. There's wage subsidy to hire individual barriers to employment, 50% reimbursement, so to speak, for up to 400 hours of initial employment. It's you know, for folks with barriers to employment, and that includes individuals with disabilities. There's a program that can help pay for a reasonable accommodation, or even, you know, more than reasonable accommodation if it's going to result in the hiring of an individual with disabilities. So I'm happy to maybe connect afterward. Heather, maybe you could connect us. I don't directly run the programs, but I can absolutely put you in contact, and I can give you the information that you would need to know about those programs. And thank
That'd
you.
be great. No, yeah, thank you so much. We really look forward to just learning more to see how we can, you know, advocate, and also have folks here in the city just help us out. So if there's anything that we can do on our end as a municipality to hire, train, whatever it is, it's just that most of the times, unfortunately, for the smallest city in Rhode Island, we have, and you know, one of the most needed and less resourceful city, most of the time it just comes down to us not having suffice money to hire individuals. And so we do have a full-time grant writer who's amazing. So he's been asking me, hey, do you know where we can tap monies for this specific program? And so, yeah, I just wanted to ask that question. So thank you.
Yeah, Suleyman, so I will arrange a meeting for us to further talk about this topic, okay?
Yeah, thank you, Elvis. We appreciate
always.
it.
Susan Donovan is raising a hand.
So you got a question?
I was just, well, we're going down a rabbit hole and I apologize, but Zulema, I just want to remind you, you've got like some rock stars over at Central Falls High School. We were there a couple of weeks ago, and I know that we work closely with Maria DeNobili, the school psychologist, and the Department of Education has a wonderful internship, promising practices for students. So they do pay the students for the internship. So don't forget some of the wonderful resources you have right in your community.
Yeah, what was the name of the program you said?
So you'll want to connect with Central Falls High School and also the Department of Education, the Rhode Island, and Kim Einloff, help me out here. Rhode Island Promising Practices, or I'll send it to you. I'm going to look it up. I'm going to look it up. Okay, thanks.
Yeah, thank you.
Send it to me too, Sue, so we can put it on the website. Anything that people want to share here, we're going to put them up so you can find it, so you don't have to go hunting around like it. Can I just jump in and say that Jean Ann Giuliano had a question that we wanted to make sure it didn't get missed there. So do you want Andrew to read it, or do you want to read it, Jean Ann?
Yes, well, I was just, Brenda actually had answered it. I was just asking if we do have our ISP renewal coming up for our sons or daughters, if we should wait to be contacted by a case manager, or if we should just go ahead and work with our previous plan writer. And Brenda said, if you've got something coming up, just go ahead and work with your previous plan writer. So not to wait for a case manager, so.
Yes. If people have plans in progress, you know, you should keep doing what you're doing until someone has reached out to you, and they'll connect with you and maybe in some way look to be part of the process if you're already going through that process, just so they get to know the individual, their team, their support network, so that, you know, in the coming year when they're doing their plan, they'll you know, just get to be more and more familiar with the individual, and plus just be able to start the monitoring process, which is part of conflict-free case management too. So. All right. I don't see any other questions.
Going back in the chat, I just want to make sure when there's a question and answer, we want to make sure everybody can hear it. Way back, someone had said for Jay, who files the ERF forms each client, and he had responded, ERF forms can be filed through the assistance of your supported employment provider agency / staff, DSP staff, or by the individual family. And then he put a link, which Deb's going to put in this recording, so everybody can find that link on the Buddha website.
Thank you.
I had a question.
Yes.
I kind of think I found this website through trying to do some research, trying to find opportunities to have a shared living home for people. And I just I haven't either gotten responded to by any of the agencies I reached out to, or if there's other opportunities like that. Someone that I did speak to told me it doesn't exist anymore. If anyone has information about becoming a shared living provider, I am a teacher in Providence, but I have lots of experience working with different.
I couldn't hear what you said, but
Sorry.
If you want to put do you mind putting your email in the chat, because then we can connect with you, because there are still you know, there are agencies who do provide shared living supports. You would need to connect with one of our providers, but we can send you information on who those provider organizations are, and you would have to go through, you know, the vetting process with one of them.
Okay.
Can I just share something?
Yes.
When I decided to do shared living, I had to go through perspective. So I don't know what your situation is, but I would just say do what she told you. You know, do what she said, and I'm sure you'll get to where you need to be.
You said you went through perspectives?
I went through perspectives for shared living.
Okay. Jonah, you want to become a provider?
Yes, I'd like.
You want
Yeah, she wants to become a provider, Jeff. Yeah.
Oh, she wants to become a. Okay, I missed that.
Yeah.
Okay.
But it's cool. It's good information either way. Yeah.
Yep.
Thank you.
You're welcome.
You're welcome. Nope. Okay, next on our agenda is an update from Ripen. So I'm going to turn it over to Sue Donovan.
Thank you very much,
Thank
Heather.
you.
Hi, everyone. So we've got a lot of stuff coming up. And we have webinars so on September 24th. We'll have natural supports, who's in your circle. On October 22nd, we have a webinar, which is our partner showcase, and we'll be highlighting Advocates in Action and the Sherlock Center. Thank you very much, Deb Kanai. She's sharing some graphics, and I know Sharon Koshin will be throwing some links in the chat for us as well. On November 8th, we're going to be hosting our first annual Self-Directed Support Conference in person at the Crown Plaza. Please see our website for registration. At the conference, there'll be a number of different sessions. Those sessions will be including what is self-direction, employment, hiring staff, blended services. We'll have a self-directed peer-to-peer mentor panel at our lunchtime plenary session, and we'll have a networking session. We'll also be providing a walkthrough of our recently launched Link with Your Community online social and recreational guide. We also have the Navigator. It's an online monthly newsletter that is now available in English and in Spanish. The Navigator provides resources each month and registration details for webinars, trainings, and events. It also features updates from our partner agencies. Just an update on our calling campaign. We started our calling campaign last year, November of 2023, and we've made 643 contacts year to date. The top issues that folks have been sharing with us as we speak with them is around staffing, finding, hiring, and keeping staff. Folks are looking for more frequent communication, whether it's with their social caseworker, the agencies that they're working with, their fiscal intermediaries, or the state. They want more frequent communication. They're looking for social and recreational activities. They want to get out of the house. What's free or low cost? What's fun? They're also looking for employment supports. So we rely heavily on our friend Jay and Elvis as we're making calls and connecting people to the right resources, as well as our friends over at the Office of Rehabilitation Services. And last but not least, certainly rounding off our top 5 is health insurance navigation. Does anyone have any questions? Oh, so speaking of the conference on November 8th, Friday at the Crown Plaza, I know Sharon Koshin is probably looking for perhaps 1 or 2 more consumers that are utilizing self-direction and that have had some successes with hiring staff. So if you do, please reach out to Sharon. Sharon, if you could put your email in the chat. I know she'd love to follow up and speak with you. Well, thank you very much for your attention, and I'm going to kick it back to Heather.
Thank you, Sue. We really want to encourage everyone to get the word out about the self-directed conference too. It's coming up quickly, and we hope that there'll be a lot of people who attend, even maybe some people who might not be self-directing their services, but be interested in just knowing more about what it entails. Will be a great day. I think they've been putting a lot of work into it, and I'm sure it will be great.
Speaking of the self-directed stuff, so we are going to be having another training. So if you do self-direct your own services and you'd like to learn how to teach other people about it, we have a Advocates in Action as a training that we're doing in collaboration with Ripen, and some of the people on the screen here already graduated. But if you are someone, so if you self-direct your own services and you want to teach other people, if you want to be a peer mentor about that, we have a 6-week training we do. We actually pay you to take the training. Ooh, you have to take all of it though. And if you skip one of the classes, you don't get paid unless you make up the class. So, it's not like an easy freebie, but you have to, if you're someone who does that, you can just contact us, Advocates in Action. We organize the forum. So just send it to that. We can put it in the chat, right, Michelle? We'll just put your ANA in the chat, the email. It'll be on the website too.
Thank you, Deb. And also I wanted to share, and we had run into Arida and one of her team in Central Falls a couple weeks ago. And we have a bilingual navigator on our team at Ripen, and she's doing outreach to our families that self-direct that have identified as needing Spanish-speaking interpreters. So she'll be reaching out to them, but please encourage your consumers and family members that want to attend the conference that are Spanish speaking. We will be providing interpreting services throughout the day in all of the different breakout sessions. So I don't want language to be a barrier, but so encourage them to sign up. Thank you.
Do we have any other questions that people wanted to ask some of our panelists or get any more information on any of the areas, topics that we've covered?
So it's not a question, Heather, but Andrew, we were going to put Andrew on the spot to give a pitch about the premiere for the at school documentary. If you have if that can fit in.
Yes.
Yeah, I
There's
can.
Andrew.
Yeah, we at Advocates in Action are having our first screening of our lab film movie, the lab film documentary that we have made almost all by ourselves. We've had help from Jim Wolpaw and Bobby Maku, co-directors, and some help from some folks at URI way back when. And now, some 15 years later, it's finally happening. We're having a screening, so.
I just put the site up with Andrew if you want to share any of those details.
Yeah, the first screening is taking place at URI's Edwards Hall on Wednesday, October 23rd. Doors will open at 6 p.m. and the film will begin at 6:30 p.m. There isn't any cost to attend this event, but you must reserve your tickets in advance. We thank the generosity of the University of Rhode Island that we can offer these tickets for free. However, again, each person must have a ticket to attend. Tickets are going fast and space is limited. You can click or scan the QR code below to reserve your tickets for the premiere, or you can just go to the website and reserve them there.
And I will say this, while that QR code, that funny looking box there, is up on the screen, you can open your camera and just hold it up to that QR code and a link will show up that you can click to get your tickets. So, and tickets really are going fast. We're not just saying that. It's like unbelievable. It's the event of the season. Thank you, Andrew.
And just so you know too, with Andrew's a good animated voice there, he's the narrator of it's a feature-length documentary and he's the narrator. And now you know why, because he's got the inflection really good.
That's right.
It's free. Spread the word. Woo, get excited. Everybody wake up.
Deb.
Mark. Or Jeff. Who just said that? Jeff?
Yeah.
Yeah, Jeff.
We were talking about the screening today, and she saw my direct support. She saw another one.
Another documentary?
She saw another screening. Huh?
Oh, you mean, well, so we just are telling people about the first one right now.
Okay.
Don't
okay.
tell anybody about the other one because we're doing the first one first.
I'm not. No. No, I'm not. I'm sorry. Okay. I'm sorry, Jeff.
No. She's just kidding, Jeff. But
I'm just buzzing you, Jeff. I'm making my goofy faces.
Yeah, we are working on a second screening, but we don't have the details all finalized yet, so we can't talk about it until we do. But someone had just asked, was it Anne?
Yeah, how long is it?
What the question is, how long is the film? It's about an hour and 10, hour and 15 minutes. The event itself is from 6:30 to 8:30 because following the film, we're going to have a panel discussion for about 30 minutes after. And there'll be people that were in the film. There'll be former LAD residents, a couple of professors from URI. We've invited Kevin Savage, but I have not heard back yet. I just emailed him like yesterday, though. So he may or may not be on the panel. We'll see. And then I think URI is going to be having refreshments for everybody afterwards. So, it's kind of a night out. It's an event.
The doors open at 6 because we want to start the film at 6:30. So get there at 6 because there's room for 900 people.
Posters, like there's stuff to do. So this is like the event of the season. I'm not even kidding. It's going to be great. Aside from the self-direct conference, which is also going to be a great event. So lots to do this fall, everybody.
And Mark just asked where it is. It's at URI's Edwards Hall, but when you order your tickets, so you're not going to actually get a paper ticket in the mail. You're going to get something in email, which just says you're registered. When you show up, we'll have your name, so you don't even have to bring that email with you. Just bring yourself, because we'll have it. And we're going to send. We were just talking about this today. We're going to send a reminder telling people, you know, you are registered.
Because I was thinking of inviting my girlfriend to this.
Do it. Do it. But if you go,
Great
you go
date
look
night
at the
material.
information. Yep. Just look at the Advocates in Action website, Mark, and it's got all the details.
Thanks.
I think
And
just
it's
do it
over
though.
at
Date night.
And it's over at 64 College Road of URI, correct?
Yes. Upper Road, 64 Upper Road, I think it's called. But again, when you go on the website and all that, all the addresses there, you can click it for directions. Yeah.
So I should get 2 tickets then, 2 free tickets for me and her.
Yeah. Yeah. Date night.
I would just have to ask her first though.
Yes.
I think
Yeah,
that's
she
too
might
far
appreciate
for me.
No, you got to be there, Michael. We're going to have everybody carpool down to URI. Rhode Islanders. That's too far. for Rhode
I know,
Islanders.
it's so true. It's like
Pack
so
a lunch. Anna's going from Newport. You can get there. Right? Anna's on the other part of the country, and she's like, I'm going.
Yep.
Rhode Islanders.
Okay. Right. Does anybody else want to make any announcements? That was a great one. Thank you. Definitely looking forward to that.
Well, I just have an announcement to make. The Same Thing Project and I are famous. And we were on the local PBS station, and if I could just show you that on screen, I could show you part of the video. It's around here somewhere.
I'm getting it, Michael. Here you go.
All right, here we
Ready? Okay, wait a minute.
All right, I got it. All right, here we go.
1, 2, 3. The big warm sun is coming to town. Buds are sprouting up from the ground. Pretty soon the flowers bloom. Let spring fever chase away the gloom. Son of a gun, we'll have some fun underneath the big warm sun. Pretty soon we'll need some shade. With all the friends that we have made, go somewhere, we'll hang out. You know what I'm talking about. Son of a gun, we'll have some fun underneath the big warm sun. Fills me with wonder, and it's gonna get warm. Out scorching hot, bees are gonna swarm. Some shade underneath the tree, just you and me under the sun. Go ahead. All right, I'm seeing pink all over the place. I ride or walk in a happy pace. Makes my spirit feel so great. Soothes my muscles when they ache. Son of a gun, we'll have some fun underneath the big sun. Son of a gun, we'll have some fun underneath the big warm sun. much I love you. Please don't take my sunshine away. The other night.
I've been coming to the Same Thing project for a few years, and I really love it. It means a lot to me. I mean, gathering friends, being songwriters, and recording artists and stuff like that. It just goes on and on and on.
My head and I cry.
It feels amazing, right? Writing on the board so that everyone can see the lyrics. Well, I'm kind of like the leader, but Mark is the real leader. 1, 2, 3, 4.
All right, let's get ready to write a song, huh? So we thought we'd come up with the idea of places you'd like to go. What are some places you'd like to go? I'd like to go to Paris. What about you, Audra?
I would like to go to the beach.
I'd like to go to some places we like. All right, what else?
Somewhere I've never seen before.
I want to go somewhere I've never seen before. That's a good opening line.
Same Thing Project is a songwriting workshop that's open to anybody and everybody. We encourage folks who've never created a thing in their life to be part of this. The mission is to find similarities between everybody from different parts of the community. We all get together, we find a common theme, and we find connection, and we reduce isolation. That's basically what the Same Thing Project is.
It's nice to do art with friends. It's something that we have in common. So especially music.
What do you love about Jade?
Just spending time with her when I can, when I'm here.
You're like her big sister.
Best friend too. Right, Jade?
That's it. That's the end of the song. Oh, we got a song, guys. Hello, ladies and gentlemen of the world. We're the Same Thing Project, and this is our world premiere of our song, Where Do You Want to Go? Count us in, Michael.
All right, 1, 2, 3, and. See you waiting out there, so come on in, that's right. I want to see something I've never seen before. When I walk out the door, I want to see some more, I want to see some more. Where do you want to go? Somewhere you've never been. Where do you wanna go? Somewhere other than here. Can I go with you? Where do you wanna go? All right. Some wanna go to Spain. Some wanna go to the mall. Some wanna see London. I wanna see it all. I wanna see it all. But just two friends together, traveling on our own. No matter where we roam, my heart is my home. My heart is my home. Where do you wanna go? Somewhere you've never been. Never
I just want to say, long live the Same Thing Project. And we'll keep on writing songs and recording songs as long as we live.
That's me and the others for the Same Thing Project.
So we'll put a link for that too, Michael. We'll put a link for that on the website too.
Yeah, it's gonna ask this.
But can you just say, Michael, tell everybody, not just that you're on PBS, but if anybody else is interested in going to the Same Thing Project, how do they get there? Because that's like a big resource. That's a big deal.
Well,
It's
if anybody
free.
could, if anybody could go to the Same Thing Project, it's at the Hope Artiste Village in Pawtucket. You'll find the OC there.
So it's on
That's awesome.
Tuesdays. We'll put the link for it because it's really cool, you
Yeah.
guys. They write a song
Yes.
every week, right, Michael?
Yeah, it's every Tuesday.
It's
It-
all
it really is
inclusive.
amazing. It's
yeah.
very amazing.
Yeah, it's
Mark
all
Cutler is
free.
amazing. Mark Cutler's a Rhode Island musician, and he's just amazing. And he writes a song with people every week. He's come to our conference. If you've been at our conference, he's the one who does the thank you, Laura. Samethingproject.com.
Yeah.
Also, Kim, do you want to read the announcement that you made before people have to leave?
Sure, I'm happy to share that the Sherlock Center just released information on a technology event on October 17th. 2 half-day sessions. You don't have to attend both. You can attend one or the other or both if you'd like. And I put the flyers in the chat in English and Spanish. I'd love to see people there.
And Andrew, can you read what Ann just put in the chat? Please.
Sure. And she said, if anyone has community events like these to share in the DD newsletter, please email them to the bhddh.askdd@bhddh.ri.gov.
Hey guys, I'm sorry to break up the thing, but I gotta go to another event, so I'll see you guys later.
Okay, Mark, that's fine. Take care. Bye-bye.
Bye. Thank you. Bye.
Bye.
Thank you.
Are we good? Does anybody else?
Everybody's
Anything to say?
announcement?
I think we're good.
Yeah.
Andrew McQuaid.
Yeah.
Waiting for anybody else. Anything else you want to share? Anything?
Or we
Thank
can
you,
sit and
Michelle.
walk in silence. It's all good. Whatever you guys want.
I'm not so good at sitting in silence.
I know, but I think
Well, I'm
everyone's
gonna
asking
say,
questions.
yes. How about we give people 5 minutes back in their day? It's a beautiful
Yeah.
day outside. Everybody go and enjoy it. Hopefully you can. And thank you though. I think it
Thank
was a good forum. Thank you for all the information from all the other panelists, and thank you for everybody who shared information. And please, as Ann said, if you have things that you want to get out to the community, please email them to us. I think Ann gave an email address. I don't know if it was her own or if it was a different address, but please
Ask DD.
email
It was
us.
the Ask DD one,
Okay,
yeah.
so the
We'll put it
Ask
on the
DD
website.
Yes, so people can, because then we can get it out in our newsletter too. So, yeah, thank you.
Thank you.
And
Alright.
thank you for
Thank you so
watching
much,
the video
everyone.
for the
Thank
Same Thing
you.
Project.
Thank you,
See you in December.
Yes.
I can't remember the
Bye-bye.
date.
Thank you very much,
All right.
everybody.
Thank you.
Bye.
Bye.
Bye. Thank you.
Bye-bye.
Contact the Division of Developmental Disabilities. Phone 401-462-3421. Para dejar un mensaje en español, 401-462-3014. Email bhddh.askdd@bhddh.ri.gov. You can watch this recording again and find out more about the topics that were discussed at www.advocatesinaction.org/DD Community Forums. Produced by Advocates in Action Rhode Island for the Rhode Island Division of Developmental Disabilities. Remember, nothing about us without us.